Amanda here, occupational therapist and owner at The Well Musician. So I've been getting a lot of questions about what occupational therapy is and how it can actually help musicians. Occupational therapy is about helping people live their best lives no matter what difficulties they may have going on. Occupation simply means a meaningful activity throughout our daily lives that brings purpose into our lives. So that could be something as simple as taking a shower in the morning, to driving your car to work, to something as complicated as playing a musical instrument. The way that occupational therapy's approach is going to be different for musicians than other healthcare providers is that I'm going to take a truly holistic view when I'm looking at the musician and their goals. So what does that mean? We all know that music is a really complex activity. It takes a lot more than physical strength and ability to be an excellent musician. It takes mental capacity, emotional capacity, and there's also a spiritual component. I don't mean a religious component when I say spiritual. What I mean by that is that indescribable feeling that we all get when we're performing music, whether that be by ourselves, with our peers, or for an audience. There's just an element of music making and performance that is hard to put in words or define. So I'm going to look at all of those things when I do an evaluation with an occupational therapy client. I'm going to look at what are your physical abilities, what's going on cognitively, what's going on emotionally, and I'm also going to look at the environment around you to see how that is either supporting or interfering with your ability to perform at your best level. The goals really are going to be twofold. I'm going to try to help you to improve your musical performance, and we're also going to reduce your risk for injury and help you to establish strategies, habits, and routines that you can take with you throughout your lifetime and into your musical career that's going to help you be able to play your best for as long as possible without getting an injury. So once the evaluation is complete, we'll get into the recommendations. For some people, this could be a one-time thing. We do a consultation and I give you the recommendations right there and you just follow up as needed. For others, I'm going to recommend that we do a few additional sessions so that I can help you to integrate the new techniques into your practice routine and into your daily life so that you can be successful. Some of these recommendations might be ergonomic adjustments, so that might be adjusting the way you're positioned next to your instrument, the height of your instrument, the way you're sitting while you're playing your instrument, postural adjustments. It could also mean making slight adjustments to your technique, how you're holding, for example, for a drumstick, making sure that you're not holding the drumstick in a way that's going to increase your risk for wrist tendonitis or carpal tunnel or anything like that. And it could also be adjustments to how you're actually approaching practice. So that could be how you're warming up, how many breaks you're taking, how you're talking to yourself while you're practicing, all of those things. There's a lot of different treatment approaches that I might take, and it all is on an individual basis based on what we discover as part of the thorough evaluation.